Hello, thank you very much for joining me. My name is Anil Tailor. I'm a consultant gynecologist. I practice in the UK. This is a short video about what it means to have an abnormal smear. What does it actually mean? To understand that, we need to understand what a cervical smear is trying to achieve or trying to detect. And very simply, a cervical smear is trying to detect a cervical precancer. A lot of women wrongly believe that a cervical smear is trying to detect a cervical cancer. That is actually not true. So a smear is designed to pick up a cervical precancer. So therefore, if you have received a letter to tell you that you have had an abnormal smear, please don't panic. It usually just means that they have detected a precancer, not a cancer. And the transition from precancer to cancer takes many years, so it can be easily treated in clinic. So how common are abnormal smears? So in England, in 2020, 2021, about 5 million women were invited to come and have a smear taken. And about 70% of those women came and had their smears done. So 30% didn't, and clearly they are taking a risk. And out of these women who did have a smear, about 5% were found to have an abnormal smear, and about 1% had a high-grade abnormality. Now, in the next one or two slides, I'll explain how smears are graded. Let's look at that. So when smears are done, smears can be normal, they can have some precancerous changes. So at the bottom end of the precancerous change is something called borderline, then there is mild, then there is moderate, and then there is severe precancer. Now, a low-grade abnormality is essentially something that is either borderline or mild, and a high-grade abnormality is something that is either moderate or severe. But what is important to realize is that all these abnormalities are still in the pre-cancer range, not in the cancer range. So all this can be very easily treated in 5 minutes. And actually, low-grade abnormalities don't even need any treatment. They are just monitored. It is just the high-grade abnormalities that are usually treated. Now, the treatment, as I said, is fairly quick and usually very simple, and can be achieved within 5 minutes. Now, what happens to women with abnormal smears? Okay, now to understand that, we need to understand what are they looking at? What is the lab looking at when they receive your specimen? So they actually look at two things. One, they look for the virus, the HPV virus. Now, there are more than 200 different subtypes of HPV virus, and they can be categorized into two types, the low-risk type or the high-risk type. The low-risk type almost never cause a high-grade abnormality, and that therefore almost never cause a cancer. And so those women with low-risk HPV are not going to develop any cervical cancer in the future, and therefore they are just treated normally, meaning their smear is deemed to be normal. They don't need any extra surveillance. Those with a high-risk HPV, now they of course have the potential to develop high-grade smear abnormality or cancer if nothing is done with that high-grade abnormality. And so it is this group of women where where there is increased vigilance. So when the lab first looks at the specimen, they will look at the HPV, whether there is high-risk HPV or not. If they don't find high-risk HPV, then that smear will be called normal, and the person will then be invited to have their next smear in 3 or 5 years' time, depending on their age. If the high-risk HPV is positive, then they will put the cells onto a slide and look at it under the microscope. And what they will do is try and look for any precancer cells. And the person, an experienced person looking down the microscope, can look at the way the cells, the shapes and their sizes, and from that they can tell whether there is any precancer going on, and they can also grade the amount of precancer that is going on. And so if in this specimen which is high-risk HPV positive, when they look at it under the microscope and they find that all the cells actually look normal. So that means cytology is normal. What they would do is they would ask the woman to have a repeat smear, say about 6 months down the line. So they will have a second smear, and once again it is possible that the immune system may have got rid of the virus, and therefore the virus may, the high-risk HPV status may now become negative. If it is negative, then the woman will be asked to have a smear in 3 to 5 years' time. If it is still positive, because the immune system has not got rid of it, then once again they will look for the cells, and once again, if they don't find the cells, meaning all the cells look normal, then once again they will ask the woman to have another smear in 6 months' time, and go through the same process. Now, if there are 3 consecutive smears whereby the high-risk HPV is positive, but the cytology, meaning the cells, are negative, meaning they look normal, then automatically this patient will be referred for colposcopy, meaning to have their cervix examined under magnification. So that will then happen after 3 smears. So that is what happens with a positive HPV but negative cytology. What if there is positive HPV, and when they have a look at the cells, they find that there are some cells that are looking abnormal or precancerous? Well, regardless of whether it is a low-grade abnormality or a high-grade abnormality, they will automatically refer that patient for a colposcopic examination. As to what happens in a colposcopy setting, that will be covered in a separate video. But these are the women who are monitored more actively. So, what is a consequence of ignoring an abnormal smear? You might think that there are women, if they've been told they've got an abnormal smear and have been told that they need to go and have a colposcopy, that they would go and attend. But again, there are women who ignore that advice and don't attend their clinic appointment. Clearly, they are taking a big risk. So, the main consequence will be that these women with abnormal cells, if they continue to progress, then they will develop a cervical cancer, which is when it will then be too late. A problem that could have been easily treated within 5 minutes now will require very major surgery to treat the problem. So it is not a good idea to ignore a colposcopy appointment. That is all I have to say for now. I have many other videos on a similar topic. Please go and search them out. And if you found this video helpful, then please consider subscribing and clicking the like button. But otherwise, until next time, please stay safe. Thank you.